Well, Belimumab is an antibody which binds to B cell activating factor, which is released by activated T cells, and it promotes the activation of B cells early on. And we know that activated B cells, in addition to activated T cells, are critically involved in chronic graft-versus-host disease. So it's a kind of targeted therapy when given early after transplant to prevent the collaboration between alloreactive T cells and B cells, which get inappropriately activated by the release of this B cell activating factor, which is coming from the activated T cells. To block that pathway results in a B cell population which is less expanding, less expansive, less activated, and does not produce, the theory is that these B cells do not produce these antibodies which cross-react with endogenous tissues like antigens in the skin or in the kidney, so many of the complications of chronic GvHD in theory would be diminished. So instead of a therapy targeting B cells and eliminating them completely, which you don't want, you just want this activation circuit to be blocked. And so that's the theory behind it. So this was a prophylaxis study, small study, to see if it actually had a signal to reduce the rates of chronic GvHD. And although the rates of chronic GvHD were low, you can't, it will require a bigger study to determine if it's really effective or not. But we were very encouraged by the low rates of chronic GvHD in patients receiving the antibody. The other thing is the antibody was really well tolerated. There were no side effects and no complications with infusions. They were given on a monthly basis, and so it was very easy on the patients. And so if you could actually develop a therapy which is safe, non-toxic, and can reduce the rates of chronic GvHD by just a monthly infusion, that would be an improvement in the field, I think.